Mrs. Smith. I'm going to be going over your discharge paperwork, and we're going to talk about one of your medications that's going to be going home with you today. So the medication you're going to be taking is called Dexamethasone, and that's the generic name, but the trade name can be also common of Dexatron or Dexpac. So the rationale for this medication that you'll be taking, it reduces inflammation and suppresses the immune system. And this can be from a cerebral edema, from palliative management, inflammatory conditions, allergic disorders, shock, a suppression to test for Cushing syndrome, MS, or adrenocortical insufficiency. Now, the mechanism of action of this medication, it's a glucose corticoids. It enters the cell, and it binds to a cytoplasmic receptor, initiating many complex reactions that are responsible for anti-inflammatory and immunosuppressive effects. So for specifics in taking this medication, it's going to be an oral medication. So with oral doses, I want you to eat it with food when possible, and this is going to help prevent the GI irritation. When given concentration oral solutions, using collaborative droppers supplied with the product, and discard the bottle after 90 days. And then mix the concentration oral solution with liquid or semi-solid foods, and this can include water, juice, soda, or soda-like beverages, applesauce, and pudding. And then with this medication, we have to have you consume it immediately, not just take it in small portions. So it has a good effect. Some common adverse effects I want you to take note, and some education I'll provide. So for the oral, it can cause atrophic skin, healing impairments of the skin, depression, euphoria, insomnia, hypercortisol, fluid retention, or hypertension. So I want you to monitor your blood pressure. And for the skin healing, we got to remember that it suppresses the immune system, and the immune system helps fight the infection. So we have to keep an eye on that and being away from people, just to limit the exposure for yourself. It can cause osteoporosis, and there's low bone density, so you're in high risk of fractures. So being safe and not having a cluttered environment can really help with that. This medication as well can cause high blood sugar levels, which is also called hyperglycemia. So whether you're a diabetic or not, I advise you to take a monitor for symptoms of hyperglycemia. And there's a mnemonic: high and dry, your sugar high. And if you have consistently drinking water or anything like that, but if you feel woozy, that's more of a hypoglycemic. But monitoring that can really help enhance the measures and making sure you are monitoring your levels. When taking this medication, don't just take it don't just take it if you take it for a long time. Like I said, it can mention osteoporosis. But when you start feeling better, don't just stop abruptly. That can actually harm you than cause any good. So whether you do good or not, whether you feel good or feeling better, you're going to have to taper off. But that's when we talked with the provider once everything settles for you. So don't stop abruptly. Otherwise, more adverse effects can occur for you. So when taking this medication as well, I want you to also know that whatever symptoms that you are experiencing that's out of the abnormal, it's okay to call the provider just to have reinsurance for yourself. But keep in mind, with calling the provider, I want you to take note of signs of infection, or if you have any round puffy face that can occur from the medication, I want you to talk to your provider for that. If you have any weight gain around your neck, upper back, chest, face, or waist, that can have to be has to have the provider aware of the symptoms, and report any signs of vision changes. Now, this can affect your daily lifestyles. Like, let's say you want to go for a drive, just hold the medication. Don't hold the medication. Sorry. Be cautious when taking the medication, and if you are going to be driving, have someone assist you in that matter. And if any of that the medication I just demonstrated, if you have any questions, please reach out as any ways possible. Any questions that you have, don't feel free to. Thank you.